This is part 2 of atraumatic care of children and families from Kyle and Carmen, Essentials of Pediatric Nursing. So we're talking about communicating with children of different ages. So for preschoolers, the more play you can involve, the better. Use puppets, storytelling, things like that. Be honest. Don't tell them there'll be no painful procedures if you're about to do a painful procedure. Be sure you use simple and concrete terms. Their vocabulary is just too limited to try and use really complex terms. They can't think abstractly, so nice and concrete. Be careful how you say things, though, because they will imagine what you're saying. And if you say, I'm going to give you a little stick, they're picturing a tree from a branch rather than a needle. So think about how something might what sort of image it might make to them. Ask specific questions. So rather than saying, how are you doing? Ask, is that place where you had surgery hurting you? Is your breathing feeling easy or hard? Because if you ask very vague questions, they can't come up with what you really are asking or a good answer for it. Give choices as appropriate. Right? We want them to have control, but they don't really have a choice of being in the hospital or not. But they do have a choice of having chicken nuggets or pizza for dinner. So those things that they have a choice, give them a choice. Because there's a lot of things they don't. And this age loves imaginative play, so do that with them. If you go in the room and they're in their princess jammies, ask, are you the princess? Are you Elsa? Are you whoever? They love that. So do that with them. This age, preparing probably an hour in advance is about right. We want to tell them what's going to happen and let them ask their questions, because often they'll imagine things that are way worse than reality. So we do want them to understand what's going to happen, but they're worried from the time you tell them. So don't tell them very much in advance, just enough time to answer questions, let them see the room, the equipment, whatever. And then communicating with school-aged children. These kids can understand much more depth, but they still need things pretty concrete. So use pictures, diagrams, illustrations, books, videos to show them what's going to happen. Let them express their feelings. And I would say if they're crying or frightened, tell them that's okay. Validate their feelings. Allow them to ask questions. And then these kids, a few days in advance is really going to be the best, because it's going to let them ask questions, kind of formulate their questions and ask their questions. How about adolescents? Well, realize these kids need privacy. Up till now, we really haven't had to worry about privacy. In fact, they probably feel better having their parents there. But adolescents, we need privacy. We need to assure them there's confidentiality, and I would say tell them what the exceptions are. If we're worried that they're going to hurt themselves or someone else or someone might hurt them, then confidentiality is no longer provided. So be non-judgmental. You have no idea what they're going to say, and they may be trying to shock you. Listen, be respectful. Use appropriate medical terms. They don't want you using baby terms that it's no longer an ouchie with these kids, but you may need to define the medical terms you use. Don't force them to talk, but certainly give them the opportunity. And about a week in advance is going to be the best for these kids, right? They're going to Google it and figure out what's going on and be able to come up with their questions that way. How about parents? Again, be honest. Don't provide assurances we can't give, but be honest and as positive as you can be. treat them as equal partners. This is their child. This means more to them than it does to you, to be honest. So keep them involved. They are an integral part of the healthcare team. Let them express their concerns and ask questions. And if you've just told somebody that their child has cancer, they need to ask you 50 times, is it really cancer? Answer them 50 times. Answer honestly and with as much encouragement as you can that this is a cancer that we have very good cure rates for. So explain things thoroughly. And tell them the long-term effects, not just today we're going to do this, but give them the full picture. Ask for their perception of how their child's doing. They know their child a lot better than you do, and they may say no. When they're like this, they're really frightened, where you think they're doing great. Encourage them to be involved, especially our little ones. Have them feed and diaper and do those things that they can do. That's the most normal to them and to the child. It helps them feel involved. It also makes life as normal as it can be. And then give reassurance, guidance, support as needed. Again, being honest, but as encouraging as you can be. So what about people where we're trying to give them handouts and flyers and information, but they're not literate? How will you know? Somebody who's struggling to fill out forms, they don't show up to appointments, maybe that they don't write it down in a calendar because they can't really do that. People are non-compliant with follow-up and treatment. History of medication errors. If they're just giving you these vague, I forgot my glasses, I'll take it and read it at home, that may be a sign that they don't want to look foolish in front of you, but they really can't read it. If you ask them questions about treatments and medicines and they can't answer them, they may be afraid to look stupid and tell you that they can't read the information you're giving them. So those are all red flags. And this, realize what we tell people, if we just give them a flyer, they may read it and retain 10%. If they hear us, maybe 20%. If we include some pictures, we're now up to 30%. People don't retain a lot of what they're told unless you get down to the bottom of this pyramid where they are using it. So they're taking it, thinking about it, applying it. That's when they really remember it. So that's better if we can get parents doing that rather than just hand them a flyer. Have them think about it, talk about it, tell the rest of the family or the child about it. So techniques to improve learning when we're giving family teaching is slow down and repeat things. We usually need to hear things more than once to get it. Speak in a conversational style using plain language. Avoid sounding too medical. And if you need to, use metaphors or other ways to explain complex ideas. Chunk the information in small bits. Don't give them everything all at once. Prioritize things. If we're trying to send a child home with a lot of equipment, what's the most important? Do that first and see how they're doing. Use visuals, right? Don't just talk. They won't remember much. And if we can make it interactive where it's hands-on and they're doing it, they're going to remember even more. So if we have young children, how are we going to teach them? Use simple, concise, concrete examples. Don't be abstract. Don't be vague. Be honest. Time the discussions so that you can prevent their anxiety, and this is where you've got to decide how far in advance to have it. A few minutes, an hour, a few days. How much time do they need to process it? They're going to be frightened from the time you tell them. So we don't want to just leave them frightened for days unless they're going to use those days to prepare and decrease their anxiety. Don't give bad news and send them to bed. So save that for when they are awake and up. Follow parents' advice and suggestions when you're teaching the child. They may say the child won't read it, or wants to draw pictures to explain it. So give the child an active role, again, that they remember better if they don't just hear it, but they work with it. Respect the child's wishes. If they say not now, come back later. And then praise the child for help and cooperation. If we do a painful procedure to a child, I always said, it's okay to cry, but I need you to hold still. And then I'd say, you did such a good job holding still, even though I was holding them still. But praise them for the things you can. And how about school-age kids? So we want to give these kids as much control as we can. Tie it into past experiences. Remember when you went to the doctor and this happened? Well, it's going to be similar to that except. And so you can kind of explain by using that thing that they remember and then telling them the difference. Actively involve the child. This age, they are doers and producers. That's what Erickson tells us. They love achievements and accomplishments. So if you can make this something active, that they draw a picture about it to tell their family, or somehow make it active. This age, they can use cause and effect. So they understand that we're going to give you this medicine that's going to kill the germs in your blood. I mean, that's not necessarily a great example, but they understand cause and effect. They also understand times. So you can talk about clock time to them in 3 hours. Younger than school age, you can't do that. They don't understand time. So you've got to use, a movie, the length of a movie, the length of a TV show, things that they would understand. This age, give them 3 to 7 days of prep time. That's going to allow them to ask questions, to really figure things out. And again, praise them for help and cooperation. When you teach adolescents, we still want to give them as much control as we can. We want to keep them involved in the decision-making process. This age, they finally can understand abstract ideas. So we can, if we're not sure what we're looking for, we think you may have an autoimmune disorder that's, we can talk in very abstract terms, and they will understand. They also can understand that this illness now is going to make whatever. I'm going to need to be coming into the doctor every year for the rest of my life, or whatever it might be. They really want independence at this age, and sometimes that means they're going to be non-compliant. It's kind of that battle for independence. Let's just work with them. Don't scold them. Let's just get them back on track. This age is where they're becoming their own person, and the parents may really have certain beliefs and values that the child doesn't share. So we need to make sure we're asking those cultural questions of the child, not just the family as a whole.